Cochlea is a Greek word. Cochlea. It is the part of bony labyrinth lying in front of the vestibule, and the Greek word, the meaning is snail. So this cochlea resembles the shell of a snail. Snail, okay. And you can imagine a central tube around which there are 2.5 turns of this cochlea. 2.5 turns. And the central tube is made up of bone. It is pyramidal in shape, and that is called the Modiolus. Okay, so this is a Modiolus actually, and around the Modiolus this cochlea is wound around 2.5 turn, and if you lengthen that coil, it is around the whole length of the coiled cochlea is around 30 to 34 millimeters, and from base to apex, this length, from base to apex, it comes around 5 millimeter. Greatest diameter around the basal coil, from here to here, it comes around 9 millimeters. Okay, so the bony cochlea lies in front of the vestibule, and it has got a 2.5 turns wound around a central Modiolus, and this Modiolus medially it is near to the fundus of the internal auditory canal. This is the internal auditory canal. So this is medial and this is lateral. So medially it is near the fundus of the internal auditory canal, from where comes the vestibulocochlear nerve, again divided into cochlear nerve and the vestibular nerve. And this vestibular nerve divides into inferior vestibular and superior vestibular. The rest you know where it goes. So this cochlear nerve comes through the Modiolus. Cochlear nerve along with the blood vessels comes through the Modiolus. That means this Modiolus is porous. It is not a hard bone. It is actually porous tube through which the nerve fibers comes inside. Okay. And this apex of the cochlea is actually, it is turned, it is laterally it projects into the medial wall of the middle ear. It comes in the upper part of the medial wall of the middle ear, this apex, and this basal turn forms the promontory. It's a bulge in the medial wall of the middle ear, that is a promontory. Okay, that much you know. So this cochlea is a coiled tube, length of around 30 to 34 millimeter. It is wound around the central Modiolus, and this Modiolus is for the passage of the cochlear nerve. So the medial end of the Modiolus is towards the internal acoustic meatus, and the apex or lateral end is pointing towards the medial wall of the middle ear, right? Modiolus, and the cochlea is wound right around that, and if you cut it, if you take a cross section, it will be like this. This is a cross section showing the Modiolus, the central part. So that is the Modiolus. I have already told this Modiolus is the central core around which the cochlea wounds around, and this Modiolus is a porous, and through that the fibers of the cochlear nerve along with blood vessels passes into the cochlea, and around the cochlea, if you are taking this as a screw, okay, if you are taking this as a screw, and there are Osseous spiral lamina, it is going and rounding. Okay, it's like the thread of a screw. There are spiral lamina, right? So in cross section, the spiral laminas will come here. This is one spiral lamina, spiral lamina, spiral lamina, and above also. Okay. So second one is osseous spiral lamina. Right? So spiral lamina, and the spiral lamina it forms the basement membrane. Right? From the spiral lamina, this osseous part, and from the rest of the basement membrane is formed by the membranous spiral lamina. So there is osseous spiral lamina as well as membranous spiral lamina. And this membranous spiral lamina, it passes from the edge of the bony spiral lamina to the spiral ligament. Here comes the spiral ligament. What is this spiral ligament? The inner part of the coil tube or the bony cochlea is thickened to form a fibrous ligament, and that is called the spiral ligament. This is this thickened part of the inner portion of the bony cochlea. It is called the spiral ligament. So this osseous spiral lamina continues as a membranous spiral lamina up to the spiral ligament. It goes up to here, and this forms the basement membrane. Okay, these two forms the basement membrane of cochlear duct. Right? This forms the basement membrane of the cochlear duct. Okay, and here one more thing you can see, that is the nerve fibers are coming and getting dilated towards the this osseous spiral lamina. If you draw this part here, it is like this. So this is your Modiolus. Okay, and this is the bony spiral lamina. And the nerve fibers are coming through this. The fibers that is coming, going to the apex, is seen in the central part of the Modiolus. This is the apex. So towards the apex, the fibers going towards the apex are seen in the central part. This is the central part of the Modulus, and towards the periphery, the fibers are towards the basal coil. Right? So centrally it is going to the apex. Now fibers going to the apex are seen on the central part of the Modulus, and towards the periphery or the outer wall, they are seen on the basal turns. Okay. And towards the osseous spiral lamina, there forms a spiral ganglion, spiral ganglions. That dilated portion of the nerve ending forming the spiral ganglion. And actually, the spiral ganglions are located in the Rosenthal's canal. There are small canals for the passage of these nerves, and towards the osseous spiral lamina, they are actually dilated, forming the spiral ganglion. And these canals are called Rosenthal's canal. Okay? These canals, Rosenthal's canal. Right? So, we have described about the Modiolus. Then, bound around the Modiolus like the thread of a screw is the osseous spiral lamina. And from the osseous spiral lamina to the spiral ligament comes the membranous spiral lamina. On that lies the basal membrane of the cochlear duct or the organ of Cotty. Okay. And I have also told about the spiral ligament. And this osseous as well as the membranous spiral lamina divides the cochlea into an upper part, that is the Scala Vestibuli, and the lower Scala Tympani. Okay, so here the upper part will be Scala Vestibuli and the lower part will be Scala Tympani. Here also Scala Vestibuli, Scala Tympani, right? So this osseous as well as the membranous spiral lamina divides the cochlea into an upper part towards the apex, that's upper is a Scala Vestibuli and below is a Scala Tympani, right? So this Scala Vestibuli continues where it is coming here, Scala Vestibuli coming, rounding, winding around, and it is coming towards the, what is here? Vestibule, right? In the vestibule, it is continuous with the vestibule. This joined to the perilymph of the vestibule where it's the footplate of stapes or the oval window, and it is closed by the footplate of stapes. Here comes the footplate of stapes. Okay, so Scala Vestibuli is continuous with the vestibule near to the oval window, which is closed in life by the footplate of stapes. And what about the Scala Tympani? Scala Tympani, Scala Tympani. Here also it comes, it's actually it is a closed tube. Okay, it is a closed tube, and it is coming, and it is a closed tube, and on the vestibular end there is a round window membrane. Okay, round window membrane, and it is closed in life by the secondary tympanic membrane. Okay, this is a round window niche. So oval window ending of the Scala Vestibuli, and the Scala Tympani is actually a closed tube, and to the in the medial wall of the middle ear you can see the round window, and that is the end of the Scala Tympani, and round window is closed by the secondary tympanic membrane. And in the Scala Tympani there is also another opening, that is the Cochlear aqueduct. Cochlear aqueduct of Cochlear, and this aqueduct of Cochlear goes to the Cochlear aqueduct. It is seen in the basal turn of Cochlear. Cochlear aqueduct runs from the Scala Tympani, from here of the basal turn of Cochlear, and it runs through the temporal bone and terminate anteromedial to the jugular bulb. So in case of transmastoid approach, if you are drilling medial to the jugular bulb, this aqueduct can be reached. And opening the aqueduct, what comes if you are opening the aqueduct? CSF, cerebrospinal fluid, will come. So in case of translabyrinthine CP angle tumor surgeries, if you want to decompress this CSF pressure, aqueduct should be opened. So that is one clinical importance. And second one is that this cochlear aqueduct lies inferior, terminate inferior to the internal acoustic meatus. So during exposure of the internal acoustic meatus, this cochlear aqueduct can be taken as a surgical landmark. We get a full, after seeing the cochlear aqueduct, we get a full exposure or adequate exposure of the internal acoustic meatus without risking the lower cranial nerves. So there are two surgical importance. So in the Scala Tympani there are two names to be remembered. One is a cochlear aqueduct and another one is the ending, it's a round window membrane. And the Scala Vestibuli opens into the vestibule near to the oval window, that's closed by footplate of stapes. So the upper part is a Scala Vestibuli and the lower part is a Scala Tympani. And another thing you have to remember that each coil, it is coiling around a central modulus. So each tube is separated from the tube in above and below by the interscalar septum. Here you can see one tube, another coil, another coil. So 1, 2 and a half. So 2.5 coil. Each one is separated from the one above and below by the interscalar septum. Right? By the interscalar septum. Okay, each tube is separated from the one above and below by the interscalar septum. So, in the bony cochlea, we have talked about the Scala Vestibuli and Scala Tympani, then the Modiolus, then the Osseous spiral lamina around, then the Membranous spiral lamina, the Rosenthal canal which lodges the spiral ganglia, and also the Osseous as well as the Membranous spiral lamina. It forms the basement membrane of the cochlear duct. The membranous portion is the cochlear duct and it is triangular in cross section. I have drawn it in green. So this is the cochlear duct, and the cochlear duct, how it continues with the vestibule. It is connected. This cochlear duct comes and it joins with the saccule with the ductus reunions. So here comes the ductus reunions part. So this is triangular in cross section and it has got a basement membrane, and this basement membrane it rests on the membranous spiral lamina and partly by the bony spiral lamina, and this length of the basement membrane increases as it goes from basal to the apical turn. From here to here the length of the basement membrane increases so that higher frequencies are heard in the basal turn and lower frequencies are heard in the apical turns. The higher that you have to remember. The higher frequencies are heard in the basal coil, basal turn, and towards the apex the lower frequencies are heard. Right? So higher frequencies down. Remember, as higher frequencies are got more weight, so they lie down on the basal coil, and the lighter one, lower frequencies, goes up and reaches the apex. Okay, that is very important during the along with the physiology of hearing. And second one is Reisner's membrane. That is, this I told is a spiral ligament. From the spiral ligament, so from the spiral ligament, a membrane coming to the, this is a Modiolus, this is your bony spiral lamina, spiral ligament, and from the spiral ligament a membrane comes to the bony spiral lamina. So this is the Reisner's membrane, and down comes the basement membrane. And inside this lies the organ of Corti, right? Inside this lies the organ of Corti. Okay. Another term is helicotrema. It comes here. Helicotrema. What is that? This is the point through which Scala tympani and Scala vestibuli communicate with each other. Okay. This is the Scala vestibuli with the footplate of stapes at one end, and here comes the round window membrane, and this is Scala tympani, and at the central point here there is an opening through which perilymph of the Scala vestibuli communicate with the perilymph of the Scala tympani, and that point is called the helicotrema. Helicotrema. That's also you have to remember. And here you can see that this is a cross section. If you cut here, there is Scala vestibuli above with Scala tympani below, and in between goes the green color, that is a cochlear duct, that is a membranous cochlea. So the tube above is a Scala vestibuli and below is a Scala tympani, Scala vestibuli, Scala tympani, Scala Vestibuli, Scala Tympani above, below, and Scala Vestibuli above. And in between comes the Membranous cochlea or the cochlear duct.